Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Hook lying knee lifts. To do hook lying knee lifts, you'll need to be resting on your back with your knees bent and your feet flat at hip width apart. Begin to find a comfortable position. We'll begin by finding spinal neutral. In spinal neutral, you'll be honoring the curves in the spine, which means in this posture, you'll have a little space under the low back. To monitor this position, you'll bring your thumbs to the bottom of the rib cage and your middle fingers to the points of the pelvis in the front and the anterior superior iliac spines, or the ASIS. We'll begin to tilt the pelvis back and forward, and then side to side, rocking the pelvis. The first is called AP, or anterior posterior neutral, and the second is called lateral neutral. Once you find that happy position of the spine where there's a bit of space under the low back, you'll begin to raise the heels slowly, one at a time, and you'll use TATD breath to stabilize the spine and to keep any tension out of the neck, the thoracic diaphragm, and the shoulders. As you progress, you'll be able to lift the knee and the foot will clear the floor. You're looking for no tipping and no rocking in the pelvis in order to assure that the muscles used in TATD breath are firing properly to support the spine, which will carry over to everyday activities. What you'll see if there isn't stabilization is when you lift the knee, the opposite side of the hip will pop up. So if I lift the right side, the left hip will pop up. And if I lift the left side, the right side of the pelvis will pop up. If you're using TATD breath, then you'll be able to eliminate that rocking and tipping, that instability, and stabilize the pelvis, training those muscles to fire properly. The emphasis in this position should be to move slowly and use small movements in the beginning, and progress to larger movements with time, as I'm demonstrating here. Make sure there's no tension in the neck or gripping in the shoulders or holding of the breath. You can also check to make sure you're not rectus loafing, which means the rectus abdominis would rise like a loaf of bread. You can read more about that in Medical Therapeutic Yoga. Start small with your movements and slow. And as you progress, you'll become stronger and have more endurance. Thank you for joining me.